Choosing the right pieces of equipment for the client and then using them in a safe and appropriate manner will ensure the clients receive a first-class treatment with instant results. All of the electrical treatments used on the face perform several functions and offer a combination of the following benefits. They improve skin condition, they improve muscle condition and the contours of the face, they improve lymphatic drainage to the face, they aid in relaxation both physically and mentally. My name is Selena, and in this unit you will understand the uses of direct and indirect high frequency, contraindications to high frequency, how to perform high frequency treatments. Using equipment safely and with confidence is essential, and it is very important that you follow the manufacturer's instructions for the machine you are using, since these will vary. Products used, treatment times and the dial showing strength of current will differ from one make of machine to another. The only way to be totally safe and competent for your assessments is to understand each machine thoroughly and know its capabilities. This will provide you with the confidence to treat clients in a professional manner, which in turn will instill the clients with confidence in your abilities. Let's assume that the facial consultation has gone smoothly. The client has no contraindications, the client is in a suitable position for treatment, and you are ready to use your chosen electrical equipment. The skin has been cleansed and is grease-free. It is still essential to further prepare the skin to be receptive to the electrical treatments you are about to perform. Remember, the different types of electrical currents have various effects on the body. Most of them will warm the skin and muscles through the increase in circulation in the area. Lymphatic drainage will stimulate by using equipment in the direction of the nodes, and the nerve endings will soothe by the heat generated. Only the faradic current is used to cause muscular contractions, and no electric current has any effect on the skeletal. High frequency is a very useful multi-purpose machine. It can be used both directly and indirectly on most skin types and gives excellent results. The nature of the frequency means the machine is quite noisy to use, and some therapists and clients may be put off by this. However, use the machine often and with practice, you will hardly notice the noise. What is frequency? Alternating current AC frequency is the number of cycles per second in an AC sine wave. Frequency is the rate at which current changes direction per second. It is measured in Hertz, an international unit of measure where 1 Hertz is equal to 1 cycle per second. A cycle is one complete wave of alternating current or voltage. Alternation is 1/2 of a cycle. Period is the time required to produce one complete cycle of a waveform. At its most basic, frequency is how often something repeats. In the case of electrical current, frequency is the number of times a sine wave repeats or completes a positive to a negative cycle. The more cycles that occur per second, the higher the frequency. An example: if an alternating current is said to have a frequency of 3 Hertz, that indicates its waveform repeats 3 times in 1 second. The high frequency current is a dampened, alternating, oscillating, high voltage, low amp current. A high frequency machine produces a frequency of 100,000 to 250,000 Hertz cycles per second. In most beauty therapy equipment has a transformer within it to alter the AC current but not the frequency. This special transformer in the high frequency machine is an induction coil called an Odin coil. The high voltage, high frequency current is not easy to confine with the installation of a wire, so the Odin coil is instead the handpiece which holds the electrode. This is why the electrode holder is round and flat. The cabinet of the machine contains the capacitator and the make and break vibrator to recharge it repeatedly. In most modern machines, an electronic make and break is used, and this contributes to the buzzing noise when the machine is working. As it alternates so rapidly, at the more than 50 times per second, the current does not stimulate motor or sensory nerve endings. It is also the alternation that produces the high-pitched sound that is characterized to high frequency. High frequency is one of the few machines that does not require two connections to make a full circuit. The current is carried through the client's body, creating warmth by increasing the circulation. Key terms. An induction coil is a device for producing a very high electrical force from a very small electrical force. Your electrode is a conductor through which electricity enters or leaves a vacuum tube. A capacitor is a device for storing an electrical charge. It is very important that you are confident in the use of the machine, as the noise level can be disturbing to nervous clients, especially if applied on the face. A thorough explanation should be given during the consultation. High frequency can be used in two different ways, indirect and direct. Indirect, the current flows through the client's body using the therapist's hands to perform massage, which conducts the current. The client holds the intensified saturator electrode. This is called saturation. With direct high frequency, applications directly onto the skin using the Odin resonator or the glass electrode. Indirect high frequency is a method of applying the high frequency current. Involves creating a circuit of current which flows from the saturator to charge the client. Your normal massage routine can be followed, but you must not break contact with the skin, so avoid all department type movements and concentrate on giving a relaxing, deep, penetrating, warm massage to those tense muscles. The therapist massages the client, which allows the current to discharge from the client's face or body to the therapist's massaging fingers or hand. This provides heat in the fingertips and creates a really deep warming massage. With indirect high frequency, you need to clean the hands with either warm soapy water and dry thoroughly or wipe with surgical spirits. Apply talcum powder to the client's hands to absorb any perspiration. Wipe the saturator with disinfectant and place it firmly in the holder. The heads are made of glass, so be careful when handling them and store them correctly. Within each electrode, a small quantity of inert gas is sealed, usually argon. As the current flows through the gas, a coloured glow is produced. The electrodes glow either blue-violet if they contain argon or red-orange if they contain neon. Contraindications to high-frequency treatments. Cuts or abrasions to the skin in the area to be treated. Skin diseases or disorders like dermatitis, eczema, shingles, which is your herpes zoster, hives, sunburn, contact dermatitis and rosacea. Highly vascular conditions. There are many conditions of the skin characterized by the overgrowth or enlargement of blood vessels. These include such conditions as hemoglomas, angiomas, port wine stains, spider veins of the legs and the face. Lasers are often the best choice in improving or eliminating vascular disorders of the skin. Sensitive skins, highly nervous clients, excessive metal in the area. Your client may experience a metal taste when working around the mouth. Swelling, edema is the medical term for swelling, can be from injury or inflammation. It can affect a small area or the entire body. Medications, pregnancy, infections and many other medical problems can cause edema. Happens when your small blood vessels leak fluid into the nearby tissue. Very hairy areas, sinus blockages, heart conditions, heart diseases like blood vessels disease such as coronary artery disease, epilepsies or diabetes, circulatory problems like your high cholesterol, heart failure, high blood pressure, which is your hypertension, angina, heart attack and stroke. You have pregnancy, asthmatics. A full consultation should be done before any electrical treatment. See your consultation for the full list of all contraindications. Skin testing. The purpose of sensitivity tests is to ensure that the client has normal, unimpaired sensitivity to stimuli such as heat, pressure, etc. that provide warning against overexposure to the effects of some treatments. For electrical treatments, there are two important sensitivity tests that should be performed: your tactile sensitivity test and your thermal sensitivity test. Before using an electrical treatment that stimulates the muscle, such as the thoracic treatment, you must make sure your client's sensory nerves are responding. Failure to do so could result in damaged facial muscles caused by the use of too high of a current. Ask the client to close their eyes, take a sharp object such as an orange wood stick, something rough, and then take a soft object such as cotton wool, something smooth, and place them alternating on the client's skin. Ask the client to say which is the rough and which is the smooth object. If the client can tell the difference, they have good sensitivity and you can proceed with the treatment. If the client cannot tell the difference, do not proceed. The treatment is contraindicated. Before using an electrical heat treatment such as infrared, you must make sure the client's skin can differentiate between hot and cold sensation. Fill 2 test tubes, one with hot water and one with cold water. Place the test tube alternating against the client's skin. Ask the client to say which is the hot tube and which is the cold tube. If the client feels the sensation of heat and can tell the difference between the tubes, then you can proceed with the treatment. If the client cannot tell the difference, especially the feel of the hot tube, the treatment is contraindicated. Some of the effects and reasons for using a high frequency treatment. The effects: it warms and relaxes the tissues, increases circulation, increases metabolism, improves the moisture and balance of the skin, calms the sensory nerve endings. Some of the reasons: helps relax the tissues, improves fine lines, improves dry or dehydrated skin, improves tired skin, and helps improves poor circulation. There are a variety of electrodes used when using a high frequency treatment. The neck electrode is a direct high frequency electrode specifically contoured for working on the neck area, but equally versatile for use in any curved areas such as the arms and legs. The saturator electrode is used for indirect high frequency only. The metal spiral inside the glass ensures that only a gentle current is required to give a maximum effect. The small facial bulb is used for direct high frequency on smaller areas such as the nose and around the ears. The larger facial bulb also used direct high frequency facial and body work, particularly useful for larger areas such as the chest and back. The wide comb electrode. Some machines have a comb-like electrode which hairdressers can use over the scalp to stimulate blood circulation to the hair follicles. All the same procedures should be followed during the treatment. After each treatment, wipe the electrode with an antiseptic solution, dry it and then store it safely. Points to remember. Indirect high frequency should be used on dry skin with a suitable massage medium. It should be used in place of the normal manual massage. The client should hold the saturator in a tagged hand. The therapist must make contact with the skin before turning on the machine. All dials on the high frequency machine should be set at 0 to begin with. Do not use deportment movements. This breaks skin contact. After massage is completed, remove one hand from the client, Turn off the machine before removing the other hand. Direct high frequency is a method of application that uses glass electrodes which are placed in direct contact with the client's skin. The current is dispersed at the point of contact with the client, and as the effects are concentrated around the electrode, they are superficial but very beneficial to the skin. It has a drying germicidal effect, often used with oxidation cream or talc. Place the saturator onto the skin before switching on. Use small circular movements, avoid breaking contact. Switch off before removing the saturator from the skin, often done after galvanic to finish treatment. Helps dry out secretions of seborrhea or oily skins. Helps destroy any bacteria present through the creation of ozone. Helps heal a problem scalp. Improves condition of oily areas like the T-zone on the face or blemished skin on the back and chest area, and also areas most prone to problems. The effects of direct high frequency treatment: improves skin texture, improves the moisture balance of the skin, helps healing after comedone extractions, provides ozone which has an antibacterial germicidal effect on the surface of the skin, calms sensory nerve endings, oxygen intake to the skin is increased when oxidation cream is used, can be used on the scalp, increases cellular activity metabolism, and the application of the direct high frequency electrode creates a warmth on the skin and converts the stable oxygen molecules in the oxygenating cream to unstable ozone molecules which have a germicidal effect. Sparking may occur when the electrode is lifted away from the skin. The spark produces ultraviolet rays which destroy bacteria. The germicidal effect is created by the ionization of the oxygen in the air, which creates ozone. Controlled qualities of ozone help to promote the healing process. However, there are risks involved. The distance between skin and electrode should only be a few millimeters, 6 millimeters, causing the current to jump across the gap in an attempt to maintain contact. Repeat 4 times only. High frequency currents should not be used on areas of skin that have been in contact with flammable liquids, such as alcohol toners, as there is a small risk that if sparking occurs, they could ignite and cause burns. Aftercare and home care. Discuss the client's normal product use. This is often the cause of recurrent skin problems, where the clients are not using the correct product type for their skin needs. Often the skin is so completely clean and has a germicidal finish with high frequency that no other care such as cleansing or toner and moisturizer are required for 24 hours after treatment. Advise the client to avoid picking or touching the skin, especially with unclean hands. Keep the skin clean. Do not apply makeup for as long as you can, and always update your record cards. Course of treatments. For indirect, treatment time 8 to 12 minutes depending on the client's tolerance. Direct treatment times would be 4 to 7 minutes, 1 per week for 6 weeks. Always follow the procedure recommended for the machine you are using. Some companies recommend finishing with oxidation cream and direct high frequency, especially after galvanic facial, so the client's skin benefits from the oxidation cream as the final product. Others continue with a mask and massage. This is especially true of companies whose products all contain the same active ingredients, and therefore the mask and massage are continuing to bring benefits to the skin. Let's review. High frequency is one machine, 2 methods, direct and indirect. This is a dampened, alternating, oscillating, high voltage, low amp current. A high frequency machine produces a frequency of 100,000 to 250,000 Hz cycles per second. Indirect high frequency, often called a venous massage. Indirect high frequency involves creating a circuit of current flowing through the client via a handheld glass rod called a saturator connected to the machine. The therapist's hands makes contact with the client and the current is discharged through her fingertips as she is massaging, creating warmth in the area. This deep massage will improve a dry skin, relax the tissues and help increase a poor or sluggish circulation to the area. Can be used in place of facial massage routine, although if clients become too relaxed, they will lose contact with the saturator, which they should be holding. Avoid losing contact with the skin as this breaks the circuit. Most frequently used on a dry face or for back massage. Most commonly used on dry or fine skins, as the medium used is oil, which will help glide of the treatment and lubricate the skin. With direct high frequency, the current is transmitted into a glass electrode, which is in direct contact with the skin. Light circular motions then disperse the current. This is a dry germicidal treatment, ideal for seborrheic skins, one that is congested or has blemishes. Most commonly used on oily, congested or acne skin types, to the face, to the back and to the chest area.